All right, so hi everyone, thanks for joining today. My name is Alex Benson. I'll be walking you through this short presentation outlining the differences between the COVID Relief Fund, CRF, and FEMA Public Assistance. Like Ashanta said, we'll have a section for questions at the end of the session, so we'd appreciate if you can hold off until then. In the meantime, let me know if you have any difficulty hearing me at any point, and I'll adjust as necessary or walk back what I said. So we're going to start by briefly outlining the basics of FEMA PA and CRF. We'll then cover some aspects of the reimbursement process, such as potential duplications of benefits and documentation required throughout the process. We'll then go on to compare and contrast FEMA PA and CRF and review several examples. From there, we'll wrap up quickly and open up for questions. Now, first of all, what is FEMA PA? By this point, I'm sure many of you are familiar in some way with FEMA Public Assistance. At its core, it's a reimbursement program designed to address community disasters using federal funding. Now, while funding offered by FEMA PA can be used to cover a breadth of categories related to the ongoing health crisis, it wasn't designed to cover certain auxiliary needs that have been identified in recent months. To that effect, the CARES Act that was passed in March of this year freed up $150 billion to help local governments deal with the financial effects of COVID in the form of the COVID Relief Fund. It's important to note that the scope of damages CRF covers is more expansive and includes any expenses that fall under FEMA PA. That said, we're going to emphasize a couple times that cities should apply for FEMA PA in tandem with CRF to maximize their available funding. Now, we've heard a couple of you ask, and I'm sure many of you are asking now, well, why would we go through FEMA PA if CRF will cover the same expenses? Which is a fair question. While FEMA PA will reimburse disaster-related expenses, they will only provide up to 75% of expenses applied for. As a result, it might be tempting to apply only for CRF and thus receive a 100% reimbursement without the hassle of multiple applications. But each city has been allotted a maximum amount of CRF funding based on your population. That calculation being your city size times 55 to reach your allotted funding. So if your city decides to solely use CRF to address expenses, you run the risk of depleting your allotted funds. Now, in the example here, a city has used up their CRF funding on expenses related to a COVID testing site, even though FEMA PA could have covered 75% of the costs. From now on, any more sought after reimbursements will need to go through FEMA PA, which might not cover the submitted expenses and will definitely only reimburse a maximum of 75%. As a result, a lot of money could potentially be left on the table. Now, while we're talking about the application process, we have a couple brief notes regarding duplications of benefits. Before we can disperse any CRF funds, all other alternative funding sources must be fully paid out or otherwise finalized. The exception to this rule is FEMA PA, which does not need to be dispersed before CRF funds are approved. For all other potential sources, we cannot approve funding without knowing if costs will be covered elsewhere. That includes any potential insurance payouts. Similarly, any amounts already received from alternative funding sources should be clearly marked so that we can determine the appropriate reimbursement amount. Donations or funding not related to expenses you are applying for need not be listed. We've seen a couple examples where donations from churches and so on of medical supplies have been included as a potential duplicate benefit. If you are not seeking reimbursement for those donations, you don't need to include them. There's going to be a section on your reimbursement form that allows you to clearly mark duplicates down, seen here. Speaking a little further on the application process, we've had a lot of people ask specifically what documentation they need to provide. Now, we've created and will be sending out a document that more comprehensively outlines what is required for certain activities. And by the way, we'll be sending out this deck as well for y'all's reference. But as a rule of thumb, all invoices and contracts related to materials, equipment, and labor sought for reimbursements must be included in the application. Regarding payroll, we need signed timesheets that delineate the hours worked and the hourly pay for the worker. For any project submission, we require a completed project worksheet. Importantly, any general or subledger records you have related to applied for funds would ease the process as well. It's important that we see some kind of proof of payment here. Now, let's briefly look at what specifically is covered by each program, FEMA PA and CRF. Some of you might remember a couple of tables from another PowerPoint that we sent out that listed out which activities fall under FEMA PA and CRF versus just CRF, remembering that any expenses that fall under FEMA PA will also be covered by CRF. Now, we combined the two tables into one that clearly visualizes which fund activities apply to. You can use this slide as a quick reference when determining which funds to use applying for reimbursement. Note that FEMA PA covers most major disaster-related activities. So that includes expenses related to health facilities, testing, medical supplies, and public safety. As mentioned, CRF is intended to be used to shore up gaps not covered by FEMA PA. Funds that are only eligible for CRF mostly fall into one of three categories: payroll, business stimulus, food delivery, and auxiliary compliance expenses, such as expenses related to homeless care, food delivery, or setting up and maintaining telecommunications. Let's look at a couple examples real quickly. As you can see here, this city is requesting just over $10,000 to cover the establishment of a temporary medical facility. That includes material and payroll costs. Now, while all expenses are eligible for a full CRF reimbursement, several line items dealing with material costs totaling $4,300 and noted in blue there on the side could also be sent to FEMA PA for coverage. Now, assuming FEMA PA provides a maximum reimbursement of 75% of costs for submitted expenses, and CRF covers the remaining 25%, the city would have saved thousands in CRF funding that could now be applied elsewhere, such as toward a small business grant. Now, while we're on the topic of payroll, we've received quite a few questions already regarding the specifics, and we'd like to delve into that a little bit while we have you all here. So there's some confusion regarding exactly which employee expenses are eligible for reimbursement. The COVID Relief Fund differentiates between employees who are substantially dedicated to combating the effects of COVID and those who are not. For those employees whose services are substantially dedicated to fighting COVID, an obvious example might be an EMT. Both straight time, overtime, and hazard pay are eligible for a 100% reimbursement. For employees whose services are not substantially dedicated to fighting COVID, only overtime that is a necessary expense as a result of the public health emergency will be eligible. An example of that might be an inspector who has to perform additional COVID-related inspections, even though the majority of their work is still business as usual. So while we're talking about substantially versus not substantially dedicated, we've had a lot of people ask us exactly what that means. Basically, it's meant to indicate any employee who spends more than 75% of their time addressing the health crisis. Funds can be used to cover an employee's entire payroll cost if they are found to be substantially dedicated to fighting the effects of COVID. To come back to the obvious example of an EMT, we know that in some areas, all emergency medical calls have been labeled as COVID-related. Now, we understand that time spent retroactively reclassifying all of these calls as COVID-related or not would be prohibitively time-consuming. So automatically, 100% of their payroll would be eligible. That said, we recommend a soft cap at around 75% to account for non-COVID-related activity. To come back to the EMT example, they're still going on plenty of calls not related to COVID that we want to account for when applying for reimbursements. But that said, 100% of their payroll is eligible, so we leave it up to your best judgment. To look at a couple payroll examples, in this simple one, a city is hoping to reimburse payroll costs related to fire department and EMS personnel. Now, since, as we said, emergency personnel are automatically confirmed to be substantially dedicated, this city would receive a full COVID Relief Fund reimbursement for the $140,000 requested. Now, to look at a slightly more complex example, here a city would like to receive reimbursement for employees who are not substantially dedicated to fighting COVID-19, that is, bus drivers. Now, since the majority of bus drivers' time spent working is not COVID-related, they're still driving students to and from school and whatnot, they would not be eligible for a 100% reimbursement. However, based on the provided scope of work we see here, the overtime spent over the weekend would be found to be COVID-related and thus eligible for reimbursement under either FEMA PA or CRF. In this situation, the city would be best off applying for FEMA PA in tandem with CRF so they can maximize their dollars. To put it more simply, if you have employees who have only had to do some extra COVID-related stuff as opposed to dedicating their job to it, apply for both. I'm sure we'll have a couple related questions to that, which we'll turn over to you guys shortly. A few last minute things. Texas A&M has an extension full of FEMA PA experts who can field any further questions you have regarding FEMA PA, regarding the application process and what expenses are covered. Now, the appropriate contact is obviously listed here along with the cities applicable to the contacts. So as mentioned, we'll be sending this out for your reference if you need to give them a call or an email. When working through the reimbursement process with us, for traceability and cohesion, please select one point of contact to email back and forth with us. It's going to greatly reduce any confusion that might arise as a result of communication. As we've said a few times, make sure that you are applying for FEMA PA in tandem with CRF where applicable so that you can maximize your dollars. Oh, an important note, apply for reimbursements cannot be used to replace lost government revenue. So if you took in less taxes this year as a result of COVID and you'd like to reimburse those through CRF, that won't be possible. The money needs to go into the hands of people. Lastly, we have a few helpful links in the back here. The Coronavirus Relief Fund FAQ, we've compiled a few different common questions that we've seen come in. We encourage you guys to take a look at this if you have any questions crop up over the coming months. But that said, please reach out to us personally with any specific questions, as I'm sure there will be plenty that aren't addressed there. We've also got a few helpful acronyms in the back here that have been used throughout this webinar that you can refer to, as well as the FEMA and CRF guidelines if you're interested in a little more light reading after the presentation. Now, with that said, we want to turn it over to you guys for questions, but I just want to make note that we have a couple tables here in the background that I mentioned earlier. If you want a further breakdown on exactly what is eligible for FEMA PA and CRF versus just CRF. And with that said, we'll turn it over to you guys for any questions you might have. Thank you.